Tripp, and then we'll go this way. The most challenging non-adherence patient circumstance you've come across, and how did you address it?
The most challenging? Everyone is equally challenging, right? So, I don't know that I can give it a specific example. The challenge is so personal to each person that is the challenge, is coming up with whatever that particular patient's reason for the non-adherence. And when I hear non-adherence in community pharmacy and pharmacists here, we think, so many claims of a prescription being filled over a certain amount of time, proportion of days covered. But really, adherence to me is adherence to the care plan to be at goal. And so, understanding what those barriers are, that's the number one thing to me, is specifically for that patient, what are your barriers and what can we help you overcome?
One that sticks out in your mind?
Mental health issues, probably. Sometimes you're negotiating with the patient and their illness. A schizophrenic or a bipolar patient has medications that tend to increase their blood sugars and increase their resistance to insulin. So controlling their mental health or improving their mental health means worsening their diabetes, and you kind of have to find a balance and a different goal for this patient. And sometimes it's talking with a psychiatrist, sometimes it's talking with the patient, and sometimes it's health beliefs that are based on their mental illness that you have to negotiate with. And this shot doesn't have bad spirits or those kind of things. And international patients with health beliefs that are completely different than American assumptions about what health is.
Right. So meeting the patient where they're at. Yeah. Behavioral health makes it more challenging to meet the patient where they're at from time to time.
You have lots of different options, ways to treat them, and you have to negotiate the way that works for them, gets the best outcome that they can deal with.
Stephen, do you have a specific adherence circumstance that you can think of in your mind that sticks out in your mind?
Since I'm a systems person, I absolutely am going with what you just said, because those were the words I had come up with, meeting the patient where you're at. So the non-adherence issue around understanding the health literacy, the health numeracy or lack thereof of the person. Sometimes it's economic, but sometimes it's not. And so really that, from a system level, where we see the gaps, if you will, or the gaping holes, is in that inability to meet the persons where they are and where the persons fall through the proverbial cracks.
I would say that I don't have one, but a common theme that I see where I sit in endocrine is when it comes to initiation of injectables, and specifically around insulin. And so one of the things that I've, over the years, have noticed and been very successful in making sure that patients do, if they need to be on it, they get started on it, is two things. Is one, explaining what it is and how it works, which is usually never the case. I have patients that I'll pick up after 10, 15 years. I was like, do you know what this is or why you're actually taking it? Other than just as for my diabetes, but if you actually explain it and how it's an endogenous hormone that is there, and then the other is actually doing the first injection in clinic. Those are the two things that I found to be extremely helpful in converting a patient, talking to them, and overcoming kind of those adherence ones, because that's the primary of my consults. Is they might be on one or two oral medications, patient's a candidate for insulin, refer to endocrine, is typically kind of the most common consult or common theme that we'll see, or patients unwilling to inject, help me figure out what else I can do if the patient's sitting at an A1C of 10 or 11, but you peel back a few of the layers and you quickly figure out, hey, they're not resistant to, they're not afraid of needles. Everyone's just inherently afraid because they don't deal with it. But
they're afraid of the unknown.
That's it.
Right.